Hello, hi, and namaste. Welcome you all to our new episode of Healthy Roots of India. In this episode, we are going to discuss about gynecomastia. Gynecomastia is a topic that need to be discussed. For that, today we have invited our guest, Dr. Siddharth Palli. Dr. Siddharth Palli is a plastic surgeon and having 10 years of experience in the field of plastic surgery. So let's welcome Dr. Siddharth Palli sir to our podcast. Sir, please welcome to our podcast.
Hi, Vishwaranjan. Thanks for inviting me to your podcast. So, I am Dr. Siddhartha Palli, consultant plastic, cosmetic burns, and reconstructive surgeon, having 10 years of experience in this field. Presently working at Care Hospitals, Vishakhapatnam.
So, as we are going to discuss a topic of gynecomastia. So, what is gynecomastia and why it's so common nowadays?
So, gynecomastia is nothing but enlargement of the male breast. So, whenever a person, a male, is having a problem of enlarged breast size, then that is called as gynecomastia. And these days it is not common. It is common from age old, but nowadays because of more exposure to social media and more exposure to knowledge on the internet, people are coming out of it more with this problem.
Okay. So, previously it was there.
Previously it was
due
there,
to the
but
unawareness-
nowadays because of increased exposure to all the social media and all the knowledge on the internet, people are more concerned about their appearance or whatever, and they're coming out with the problem.
So, sir, what is the common cause of gynecomastia and how a common man will differentiate it or how you differentiate it?
So indirectly, you want to know from me what are the different types of gynecomastia and how to differentiate between these things, right? So broadly, gynecomastia can be classified into two broad categories. One is physiological gynecomastia. The second one is pathological gynecomastia. So in physiological gynecomastia, what I mean by that is gynecomastia can occur in normal individuals also in three stages of their lives. One is immediately after birth, infancy. The reason being the mother's hormones, they cross the placental barrier and they get into the child's blood also. So that will cause a slight puffing of the nipple or any nipple discharge kind of thing. Most of you might have observed in many children while they're born. The small nipple size increase or small discharge from the nipple, it is nothing but infantile gynecomastia. And the next stage when it can occur is prepubertal gynecomastia or pubertal gynecomastia, wherein during teenage years or pubertal years, once again the hormonal imbalance occurs or hormonal changes occur in the body of an individual, a male person, and because of that, again gynecomastia can occur. This is very much normal, nothing to worry about it. This typically occurs between 12 to 16 years of age, like that. Then there's something called as senile gynecomastia. In senile gynecomastia, once men reach andropause or they reach an upper age limit, like something like a more than 65 or more than 70 years, then because of the decrease in androgenic hormones and imbalance of hormones, again gynecomastia can occur in males. It is also very much a normal phenomenon, nothing to worry about it. So these are the broad categories in physiological gynecomastia. So if we talk about pathological gynecomastia, this is where we actually have to worry. So coming to pathological gynecomastia, again it is because of so many different causes. The common ones being any diseases like liver disease or any carcinoma liver, sometimes even renal disorders like kidney diseases, or in other instances usage of any drugs like drugs used for liver disease or renal disease again. These drugs also can cause gynecomastia. So these are all pathological or drug-induced gynecomastia, it is called. So these are the two things that is described in the book. I want to add a small point from my side here, which is nothing but I like to call it psychological gynecomastia. It's not written in any book or anywhere, but psychological gynecomastia in the sense the persons, because of overexposure to social media and overexposure to films and media, the person thinks he has gynecomastia while he is absolutely normal. He is within the mean standard deviation of the population, but he thinks he has gynecomastia. Seeing some hero figure, he keeps comparing his body to them, and he thinks some condition he has which he actually doesn't have. So I like to call it psychological gynecomastia.
Sir, as we have discussed right now regarding gynecomastia and its causes, could you please explain how does gynecomastia affects person's daily life and what are the common challenges a person faced those who are suffering with gynecomastia?
So, gynecomastia affects these people in a very, very big way. You can't even imagine what all they go through, these people. Mainly, it affects their self esteem and brings down their confidence levels a lot. Just for example, take a child with gynecomastia. Nowadays, again, because of more social media exposure, children are also more knowledgeable than we were at the same age, isn't it? So the other children in the school, they keep teasing him by saying multitude of things, and so the child is depressed. Sometimes he doesn't like to go to school, and he comes home and complains to his mother or father, I will not go to school, and he can't divulge the reason also. The same thing happens to an adolescent or a teenage boy who goes to either 9th or 10th class or any intermediate studies, so or any first or second year of the degree college. So in all these areas, the other children or other boys, they tease him a lot. And once he grows a little older, maybe he's in a relationship with a girl or something like that, the girl, his girlfriend or somebody may point out to him that you are not normal, or you are not looking normal. That may affect his self-esteem in a very bad way. So these are some of the very common and basic challenges faced by these people. And most of these people, they can't wear normal clothes like all others. They keep going for XL or XXL size clothes, though they are of small size. You understand what I mean, right? So they buy clothes which are much more sizes than they are, and they can try to conceal their gynecomastia in those clothes. And the other thing which I commonly hear, very commonly hear, is for example, a family goes on a vacation. A teenage boy with gynecomastia is among them, or a 20-24-ish guy is among them. So everybody is going for a beach picnic or something. Everybody is undressing. This fellow, he can't remove his shirt. He's so scared to remove his shirt before his own family members, that he will completely avoid that activity only. He will not go to the beach only. He will not go into the ocean only. He will just try to give some lame excuse, and he'll just try to stay at home or in the hotel. So that is the level of decrease in their confidence level we commonly come across. And I really feel sorry for them. I really feel sorry for them.
Is it real, sir? The people are suffering like this, and I was thinking that it's a kind of medical issues, but mental issues also involved in
Yes,
this type
yes,
of
yes,
cases.
definitely. There is a lot of mental trauma involved in these cases. You will not even know what they go through. You can't even imagine what they go through.
As gynecomastia is a condition where a child or a patient feels so embarrassing. So, uh, is there any kind of medication so that person will take and get healed, or surgery is the only way to get out of it?
So, a very good question, Vishwa. So, like you rightly asked, gynecomastia has medical treatment or only surgery is the option? That's what your question is, right?
Right.
So, gynecomastia, like you asked, doesn't have any medical treatment till date. It only has a surgical treatment. So, many people come to me with the same question because of ignorance or some mistreatment by some other quacks, or some RMP may tell them to go to someone who's giving some miraculous medical treatment for gynecomastia. And patients, just because they're ignorant and they are suffering from the problem for so many days because of the mental trauma and all, they just blindly believe these people, and they go for multiple kinds of injections, both systemic and local injections. They keep giving them for years together, charging a lot of money from them. So all these things are happening, but in reality, gynecomastia doesn't have any medical treatment to date. It only has surgical treatment, which will completely remove the problem.
Sir, as you just told that surgery is the only treatment for the gynecomastia, then what are the surgical techniques are involved for the gynecomastia surgery, and which is the most effective one?
So, okay, the different surgical techniques available for gynecomastia surgery are some of the following. One is open surgery or open technique, wherein you give an incision at the areolar complex, and you remove the gland. It is nothing but gland excision, open excision. And the second one is liposuction, wherein, putting it simply, you make a half or 1/4 centimeter incision somewhere far away from the breast area. You introduce a cannula kind of thing inside, and you aspirate all the fat through it. So whatever fatty tissue is there, which is protruding the breast forward, we just aspirate it off with this cannula. This is called liposuction. So liposuction is one way, and gland excision, open excision is another way. Usually, in huge gynecomastia cases like grade 3 and grade 4, we as surgeons, we like to combine both of these techniques, which will give a very beautiful result. I nowadays I'm combining both these techniques in almost all the cases because it is giving a very beautiful contour and a good result finally. We do both liposuction and gland excision. Both combining is the most recent way and a better way of doing it.
Sir, just now you have a discussion that gynecomastia is only treated by the surgeries. There are two types of surgeries. One is gland excision and another liposuction. So once surgery is done, what are the risks and complications involved in the surgery?
So, Vishwa, for any surgery, there are essentially some different stages where complications can occur. One is in the preoperative period, second one is in the intraoperative period, and third one is in the postoperative period. So, in the pre-op period, if we don't work up the case properly, we don't do all the investigations required, or we jump into surgery very fast after seeing the patient, complications can occur because the patient may be suffering from any unknown medical condition or any other surgical condition which we overlook or ignore, and that may cause him to have some kind of complication on the table during surgery. So that we have to rule out. Then intra-op complications are again of two types. One, there can be hematoma, which is nothing but bleeding, which is not stopping, but usually it is very rare and done under proper anesthesia and under proper conditions. Any surgery is a very safe surgery in the hands of a registered plastic surgeon. Okay, and the second thing is infection, which can occur in the post-op period. So post-op infections are also very, very uncommon when done in a proper setup by a board-certified plastic surgeon again. So these are the complications which can occur, but usually they don't occur. A very rare chance of hematoma and infection can be there. And a very, very rare, the rarest of the rare complications is skin necrosis. If you thin out the skin a lot in view of removing a lot of fat and gland, a small portion of skin or nipple can get necrosed. I have never seen this complication in my 10 years of experience, but reports have been there in literature of skin necrosis also, but usually it is not at all common.
Let's say, sir, there is no complication, there is no risk in the surgery. How long does it take to recover a gynecomastia surgery, and what are the post-operative care the patient has to take care?
So once we perform a gynecomastia surgery, that is reduction of the breast, usual post-operative care will be like something like this. The patient goes home on the same day or on the next day morning. That is, it can be done under daycare surgery. Sometimes even less than 24 hours admission also. So then once he goes home with the drains placed inside, which is for collecting the blood which comes out after the surgery, and a compression garment in place. So compression garment is a garment which we put on the patient's chest after performing surgery to compress the chest so that no hematoma occurs. So these are the two things the patient goes home with, and the usual dressing care and everything will be told by the surgeon obviously. The dressing change will be around alternate day or once in 2 days, and drain removal will be there after 2 to 3 days, say, depending on the collection of the blood. And the compression garment will stay on for another 2 to 3 months with the patient. So this is the post-operative care. Once this is over, if we talk about the recovery period, so the sutures, they usually heal within 10 to 12 days, and the whole surgical area or the wound, which it will heal in around 15 to 20 days. And the patient is advised not to lift any heavy weights or not to overstretch his arms, or no overhead abduction of the arms. Such kind of care is told to the patient to take care of it. And once a period of 1 to 2 months is over, he can go back to all these activities also. and we tell the patient to avoid his gym sessions for around 1 to 2 months, after which he can go back to his weightlifting and gym training. So, and we also tell the patient not to go driving two-wheelers or cars, because there again both the arms will be involved in driving, and the patient will feel a pinch of pain in the chest. So we try to tell the patient to avoid that also. So once a period of 2 to 3 months is over, the patient will completely be getting back to his all his usual activities, including heavy weight lifting. So basically, the downtime after gynecomastia surgery is only for 2 to 3 days. After 2 to 3 days, the patient can go back to his all his usual activities and all his low weight activities. And for work, he can go immediately. The next day only he can go to work, and all household chores he can do after 2 to 3 days by himself, no need of any assistance also. So this is the advantage of gynecomastia surgery, that it can be done as daycare, and it can be done not disturbing the patient's daily life much. So that's about the recovery of gynecomastia surgery.
Sir, you just said right now about the compression garments. Why it's necessary to use just after the surgery, the compression garments?
So compression vest is nothing but a tight elastic garment, a complete bunion kind of thing, which will cover the whole chest of the patient, which we like to wear immediately after the surgery. Because in gynecomastia surgery, what we are doing essentially, we are removing the contents of the breast, leaving the skin there. So there's literally a hollow inside the skin, which needs to be obliterated or compressed, so that there is no collection there. There is no collection of blood or body fluids in that hollow cavity. So the compression vest wearing immediately after surgery becomes very important for us. And the second thing is, if we don't wear the compression vest, the skin may sag down and it may not stick properly to the muscle beneath. The pectoralis major is the muscle beneath that skin. It will not stick to the muscle. So the contour of the breast may get altered, or there may be any wrinkling of the skin in the post-op healing period. To avoid both of these complications, we like to wear the compression vest immediately after surgery, which will conform the skin posteriorly onto the chest, and it will give a very good plain clean shape to the chest.
Okay, sir. This is why the immediate after surgery, a compressor garment has to be wear.
Yes, that's exact reason. Yeah.
Okay, sir. Can gynecomastia surgery be done in children, or it is only for adulthood?
So, doing surgery for gynecomastia in children is not at all correct, because children, they're still developing, and like I told you before, in teenage up to teenage years, there is physiological gynecomastia, which is very much normal. So there's no need to go for a surgical treatment for a child. You can wait and watch, or wait and see till he reaches adulthood, or at least he hits puberty or completes puberty, or past once he's past his teenage years. Still, if the gynecomastia is persisting, then we can go for surgery in them. But typically in children below 10th class or below 12th class, they bring for surgery for gynecomastia, which I personally wouldn't encourage them to go ahead with it, because it is not in the correct spirit. And in teenagers also, I always tell to my patients, in only special conditions, like for example, there's a lot of teasing going on in the hostels, or there's a lot of bullying going on with the child in the hostel. In such situations, when the child is not able to bear it anymore, or is going into some kind of depression or depressive episodes, then the parents bring them to me. Then I perform surgery in them, because of the ethical reasons and the psychological impact it has on the child. We need to treat it surgically. But otherwise, even in teenagers, I would not personally recommend them for going to gynecomastia surgery. And in post teenage, up till whatever age, it is very much normal to go for a surgical removal of gynecomastia, and it's very much the treatment of choice.
Sir, what are some common misconceptions about gynecomastia, and how we can raise awareness about the gynecomastia?
So some common misconceptions about the gynecomastia condition are it's still in villages till today. Some of the people, they think that boys with gynecomastia, they're actually females, or they are something like an intersex syndrome. So they are, and some people think they are impotent. People with gynecomastia also suffer the impotence. They think like that, but which is actually a very, very untrue. It's completely false propaganda, and we need to completely clear the people of these foolish fears. Okay, and thinking about awareness. So awareness is nothing but, see, now what we are doing is raising awareness only.
Yes.
So this is how you raise awareness in a society. You
To educate.
talk, you educate them through multimedia channels, or through podcasts like yours, or through print media, and sometimes through symposiums, conferences. So whatever will reach the public,
Yes.
we have to reach those podiums, and we
Yes.
have to talk out. So this is how you raise awareness about this condition. It's quite simple, and you're doing a very good job by doing this thing. I really congratulate you and appreciate all your effort, Vishwa.
Thank you,
Thank
sir.
you for
Thank you.
having me here. Thank you for calling me.
Thank you.